Medicare is set up in such a way that most people make the wrong Medicare decision, which jeopardizes a lot of money for them and benefits in most cases the insurance companies. But here's the thing, after helping over 10,000 people with their Medicare decision, there is a 4-step process that you can follow to avoid all of these mistakes. So in this video, let's talk about what those steps are so that you can avoid the common Medicare mistakes that so many people make. So the first step to making your right decision is knowing when to join Medicare. Now, I know this sounds simple, but too many people miss this first step, which leads to some of the most common mistakes. I got an email yesterday from Ron, and Ron says, I had no idea that I had to join Medicare at 65 as I was working afterwards. So let's get clear on what the Medicare rules say. Medicare rules say by the time you're 65, you either have to be on Medicare or on an employer health insurance plan that meets Medicare rules. Now, there are 3 main things that have to be met by your employer plan. It can be yours or a spouse's employer plan to meet the Medicare rules. Number 1, the company has to have 20 employees or more. Number 2, the company cannot require you to join Medicare Part A or B. And number 3, the company must have creditable prescription drug coverage. Companies are legally required to send you a letter confirming their creditability every single year. So ask your HR, your benefit person at your company, to confirm that for you. They're legally required to do so. So if you have an employer health insurance plan that meets these Medicare rules, you can absolutely delay Medicare. Now, in Ron's case, his company did not have 20 employees. And so by him delaying Medicare, he now has some really big penalties. On the other hand, though, I see people who do have a plan, an employer plan, that meets Medicare rules, but they join Medicare at 65 anyway. But here's the thing. When you join Medicare, when you already have an employer plan in place, it's usually a total waste of money to pay for both Medicare and the employer plan. So please be thoughtful, know the rules, and join Medicare at the right time. So step 1 is all about joining Medicare at the right time to have coverage, but to also avoid penalties. Step number 2 is deciding which program fits you best. Now you might say, well, Emily, what is that? I don't know. The thing is, there's 2 main programs when it comes to Medicare. There's Original Medicare, also called Traditional Medicare. And if you're on that route, you're going to have your traditional Medicare Part D, as in drug coverage, as well as your Medicare Supplement, also called your Medigap plan. On the other hand, we have a program called Medicare Advantage. Now, you oftentimes see commercials for either Medicare Advantage or Medicare Supplement. Those are 2 different paths and will be treated differently and depending on which path you take. Here's the key thing to be aware of. There are many differences between the 2 paths that most commercials, most information don't clearly explain to you when it comes to making your Medicare decision. Usually you see ads or hear from an insurance salesperson talking about join this plan or join that plan, but they don't fully tell you or explain to you how they're different, how they're similar, and the option to switch in the future. At a very high level, when you're on Original Medicare, you can see any doctor across the entire country who accepts Original Medicare. Studies show that about 95% of US doctors take Original Medicare. If you're on Original Medicare, you'll have Medicare Part A and B, which covers mainly your hospital and your medical coverage. You will likely also have your Medicare Part D drug coverage to cover your prescription medications that you get from a pharmacy. And you will also have a Medicare Supplement plan, also called a Medigap plan, to help cover some of the costs that Medicare Part A and B don't fully cover. So that is one path. The other path is Medicare Advantage. If you're on Medicare Advantage, you must still be on Medicare Part A as well as Medicare Part B. Medicare Advantage tends to work like HMOs or PPO plans, so they can have networks, and it tends to be a lot cheaper if you go to an in-network doctor. So, depending on the doctor that you see, that could be a big factor. Advantage plans also usually cover your prescription drug coverage, and they also have their own built-in deductibles, copays, and maximum out-of-pockets that can be over $10,000 a year in some cases when it comes to your coverage. So I cover this in more videos, and if you want a full download, click the link below. I have some extra resources for you. But my point is, these programs are very, very different. We want to be very thoughtful about which one fits you best. And here is why. In most states, Medicare will not allow you to easily switch from Medicare Advantage back into Medicare supplement plans. So I find that people who tend to be the healthiest tend to join Advantage plans first because they tend to be cheap and fine for what they need. But when they get unhealthy, when they have health bills, they want to go back into original Medicare with a Medicare supplement plan. But the key is, because of guarantee issuance rules, because of certain rules around supplement plans, you're not guaranteed to ever switch in the future. So usually people go to the insurance companies or the agents to sign up for a Medicare plan of some type without really understanding how it ties into the underlying Medicare rules that the government has set up. So if you miss this step and you pick the wrong program, you can be disappointed in the future, and it can cost you a lot of money. So step number 1 is when to join Medicare. Step number 2 is properly deciding between original Medicare and Medicare Advantage. In most cases, the way that you decide which program fits you best is based on your doctors, right? What type of Medicare does your doctor accept? Number 2, what flexibility do you want to have in the future to see new doctors or to deal with prior authorization requirements? Number 3 is usually cost. Copays, max out of pockets, medication copays, things of those details. Finally, 4th can be extra benefits like vision, dental, gym membership, hearing, over-the-counter benefits, things like that. That's usually the last factor to consider when it comes to deciding which program fits you best. Now, once you decide which program you want in step 2, step 3 is deciding which specific plan and company do you want. I'm helping out a client right now, and he has 48 Advantage plans to pick from. He has 24 Part D plans to pick from, and over 50 Medicare supplement plans to pick from. It's a lot. So we don't want to look at all the things. We want to really narrow down which one fits you best, okay? Your prescription drug will kind of determine which Part D plan you get, as well as which company you get, as well as your pharmacy. When it comes to Medicare Advantage, it's more again about the doctors, the costs, the coverage, things like that. And Medicare supplement is all about deciding which company, which letter fits you best for both now as well as in the future. It is easy to change Medicare Advantage and Medicare supplement plans in the future, so we don't have to be 100% accurate the first time, although we should be. But Medicare supplement plans, in most cases, you are not guaranteed to change those plans in the future without providing your pre-existing health conditions. So we want to be very, very thoughtful and accurate when it comes to picking out the right Medicare supplement letter as well as company. Too many people do not understand how the long-term rules impact what they do when they first join Medicare. So please be thorough and get it right the first time. Again, if you want more details on that, I have a link below for extra resources where I cover it all in a lot more detail. Now, once we've determined when to join, which program fits us best, original Medicare or Medicare Advantage, which specific Medicare Advantage, Part D, and or Medicare supplement plan fits you best, we then need to actually enroll in Medicare and make it official. Now, for Medicare Part A and B, you enroll directly through Medicare/Social Security when it comes to those benefits. However, all other plans, Medicare Advantage, Medicare Supplement, and Medicare Part D plans are all offered through private insurance companies. So you're going to go to a few different places. It is very common for your Medicare Supplement company to be different from your Medicare Part D drug company. But again, there's different places to go to officially put your plan in place. So here's the thing. When it comes to Medicare, most people, when it comes to the decision, will jump directly to step 3, picking out a plan and a company based on ads or salespeople. That's not the right thing to do, and that's why so many people regret their Medicare decision. So follow these 4 steps. Again, when to join, which program, Number 3 is which company and plan. And number 4 is make it official. Make sure you click below to get extra resources and follow along this video. Like this video below to get more inside tips and shortcuts when it comes to Medicare. Again, I'm Emily with the Medicare Coach, and thanks for joining me here today.